We've talked a little bit about what people that have an advance directive can do on National Healthcare Decisions Day. How about those people that don't have a directive right now and that haven't had a planning discussion? We've talked about agents or a representative to speak for you. How can someone go about selecting that? What should they be looking for in a person?
Well, the typical thing that people do, and an understandable thing that people do, is pick someone who they are very close to, have a close relationship with, and usually lives in the vicinity. And those are understandable selection criteria, but often they don't come up with the best person. You really need to playing this role of a healthcare agent, someone making healthcare decisions for someone they love very much, is a very difficult thing to do. It creates a lot of stress and a lot of burden. At some point, you will likely be making a life or death decision for someone else. And so you need to pick someone who has the personal qualities of a good decision maker. So first of all, when you pick someone, you need to talk with them. And they need to be willing to talk with you, because that burden of decision making is reduced when there is a good understanding between the person who's being represented and the person who's making the decisions. Secondly, they obviously have to be willing, and you have to trust them and all those kinds of things. But probably the most important and key characteristic that often people don't think about is, can this person make extremely difficult and complex decisions in sometimes very stressful situations? So I've seen instances where one spouse has picked the other, but the spouse who's picked to make the decision is not a good decision maker. They're not comfortable with that role. And this isn't about men and women, because I've seen it go both ways, whether it's the husband making the decisions or the wives. They're simply not comfortable with this kind of responsibility, and so they almost fold. They just, I can't do this. And yet when you look at the family, what you realize is that there's a son or daughter, or maybe a brother or sister who could fill that role perfectly. And so when you're picking someone to make your own healthcare decisions, you need to pick the person who's close to you, who you trust, who's willing to talk with you, but you also need to find that special person who can come into that situation, feel comfortable with the responsibility and sometimes the conflict that comes with it, and make the decision on your behalf so that you get the care that you want and you don't leave your family in turmoil. Because when you pick a poor decision maker or someone incapable of filling that role, not only are you likely to get medical care that you didn't want, but you're also likely to throw your family into conflict and turmoil, which is one of the things you're actually trying to avoid.
And I think it's also one of the things we try and help our facilitators accomplish, is to get the person's loved one, the person they've chosen, in a dialogue. So rather than just work with one person in terms of what wishes they would want for future health care, get their chosen loved one together and say, this is what this role means. Not only is he choosing you and you've agreed to and you can make decisions, but let's walk through what it would mean to make a decision on the part of another person. Let's learn about that person's values. And so we really encourage the dialogue to happen from the very beginning rather than keep it a secret, keep it quiet. And whenever possible, we'll do family types of discussions as well, because then everyone gets to learn. It's not just the person you've chosen, but the rest of the family gets to hear what your goals and values are. And even if they're not the person then that's chosen to be the decision maker, they can be supportive. That's certainly what I did with my 3 adult sons, is help them understand what I wanted my oldest son to do, and that way they could be very supportive. So we really encourage a much more open dialogue about not only the choice, but then also about how that person needs to think about their role and be supported by the rest of the family. And I think too many times we have people say, well, this is about what the person wants, and we should just focus on autonomy, just what does the person want. And we really, in our training and really in our philosophy, we really think it's much more about family decision making, however you define family, and helping people get prepared. But too many times it's done behind closed doors and without much discussion, and we think that leads to poor decisions at the bedside and not very healthy ones maybe for the individual who has to make them.